oo.
20
Yes.
million
Oo,
po.
oo. So kami ay nag-submit ng proposal na around 36 billion. Ah, kasi naman ilang taon ng sunod-sunod na 20, 21, 22 ang aming budget. 20 billion, 21 billion, 22 billion. So ngayon ay nag-submit uli kami ng 36. Ang inapruban ay 23.
Sir, nawawala yung kaya muna natin.
Nawawala siya.
Oo, mahirap ang StreamYard eh. Oo, oo. Oo.
Kaya namin.
Oo. So, okay. So, yun ang nangyari. Kaya yung mga bagong proposal ay karamihan ay hindi nakasama. Pero yung sa Virology Institute, dalawang bahagi ang budget noon. Yung infrastructure ay ang balita sa amin, wala nga doon sa aming budget pero mare-reflect daw doon sa National Capital Infrastructure Program, makakasama sa Build sa DPWH. Yun namang parang pang-umpisa ng research, binigyan kami ng around 300 million na bago. Kasama yun doon sa nadagdag na budget. Pero maraming mga proposals na hindi siyempre nakakasama katulad nung proposal ng aming Philippine Nuclear Research Institute, bumaba yung budget nila. Doon pa naman sana mag-uumpisa yung programa sa nuclear medicine dahil nga sa bawat taon ay mahigit 70,000 ang ayun ang dinig ko, 70,000 ang namamatay sa cancer na hindi man lang nila nalaman na may cancer sila dahil sa kamahalan ng PET CT scan. 70,000 daw ang presyo ng CT scan na yon. Kaya hindi mo man lang malaman kung ikaw ay may cancer o wala. So ang hangad ng aming Philippine Nuclear Research Institute, dahil nakipag-diskusyon na rin kami sa International Atomic Energy Agency, bigyan namin ng priority yung nuclear medicine part. Magka-collaborate naman kami ng Department of Health. Pero hindi na makakasama yun ngayon, gawa nga nung hindi na-approvean yung mga bagong proposal. Meron kaming budget para sa Food and Nutrition Research Institute na ang buong building nila ay nasa ibabaw ng fault mismo. Hindi rin kami binigyan ng bagong budget para mailipat namin. Kaya at risk yung aming mga empleyado sa Food and Nutrition Research Institute dahil hindi mo masasabi kung ano mangyayari. So yung mga ganon, yung sinasabi naman nila na meron daw kaming grants in aid, yun ay may kinalaman sa mga research and development institutes namin. Maniniwala ba kayo na 7 ang aming research and development institutes na maghahati-hati sa 0.6 billion na budget, 2.6 billion pesos. At bumaba pa yan from last year. Ang sinasabi naman, pwede naman kumuha doon sa grants in aid. Yung grants in aid, yun yung Central Fund for Research na hawak ng Central Office at saka ng mga councils namin. Pero sana kasi yan mas iniaabang namin para sa ibang mga institusyon at hanggang as much as possible ay ina-allocate namin hindi lamang sa sarili naming institute. Kaya yung sinasabi nilang may GIA, kasama yun doon sa GIA, kasama yun doon sa 23.9 na i-approve. Meron din naman kaming dapat ipagpasalamat kasi dinagdagan ng DBM yung aming budget for scholarships. From 4.5 billion ay tumaas sa around 6.7 or 6.9 billion. Yun yung isang binigyan nila ng increase. Ang isa pa naming idinadaing yung aming tatlong council. Meron kaming council for agriculture, meron kaming council for health, at meron kaming council for industry and energy. Yung agriculture, mulat sa pulpa, malaki ang share niyan kasi yun ang kauna-unahang council namin itinayo. Ngayon, yung sa health ay halos kalahati lang ng matatanggap no sa agriculture. Alam naman natin na napakaraming pinagkakagastahan ngayon ng aming Council for Health. Ito lang mga trials na ito sunod-sunod. Huling in-approve namin ay halos 90 million para doon sa ating solidarity trials for vaccines. Kaya yun nga, kung kukuwentahin mo kasi yung 23.9 billion, 'pag hinati mo yun sa 4.5 trillion, one half lang yun ng 1%. Yun ang budget ng DOST.
Oh dear. So, ano po ang mga pinaka magiging adversely affected dahil nga po sa hindi na-approve ang mga pinopose ninyong budget?
Oo.
Ano po yung medyo mamimimigro ng gusto? Kung
Yun
meron
nga dadagdagan ko na lang yung sinabi ko, una, yung aming, budget for health research na inaasahan naming maraming magiging pangangailangan, hanggang dun na lang sa dating level ano. Yung, sinabi ko kanina na yung aming, bagong proyekto for nuclear medicine ay, hindi muna matutuloy. Yung, aming pagpapalit sana ng building para sa Food and Nutrition Research Institute na malaki din naman ang role na ginagampanan dahil sa ating malnutrition problem, hindi rin matutuloy. Nandiyan na rin yung aming, case ng aming, PBOLs halimbawa na yung pagpaparami ng kanilang mga monitoring stations ay, every year sana yan ay nadadagdagan, tigil muna ngayon. At, nandiyan din nga yung aming, iba pang institutes na, mangangailangan sana ng dagdag para sa mga bagong proyekto or pag-expand. Katulad po nung aming Metals Industry Research and Development Center na napakarami pong facilities niya na na-build up over the years at saka sila din ay, national testing center ng lahat ng may kinalaman sa metals. Bumaba pa po yung kanilang budget. So, yung mga pambili ng materyales para sa pagte-test sa laboratorio ay apektado at saka yung kanilang mga research na, isinasagawa din. Yung aming Philippine Textile Research Institute, bumaba pa by around 30 million yung kanilang, budget. So, yung naumpisahan naming production ng yarn for cotton last year at kami ngayon ay magmo-move over na sana sa silk, diyan sa aming mga facilities sa Valencia, sa Misamis, maaapektuhan din 'yon. Yung, aming, proyekto sa ano pa ba yung nasabi ko, textile, metals at saka yung, Nuclear Research, Institute at saka dun sa Food and Nutrition Research Institute, yung kagustuhan namin na madagdagan sana yung mga pagawaan ng aming, complementary food para sa mga bata na apektado ng malnutrition. Ngayon meron kaming 37 nun all over the country, pero yun ay nai-turn over na namin sa mga nagpapatakbo katulad ng mga state universities na merong food tech program, katulad ng mga LGUs na talaga namang, mataas ang ibinibigay nila sa, malnutrition reduction at saka meron ding ibang private sector na nagpapatakbo. So yun ang mga maaapektuhan.
Secretary,
Anyway, yun lang po.
Secretary, beyond po yung actual figures na hinihiling natin at saka ibibigay, siguro ang gusto talaga maintindihan ng tao yung pagpapahalaga natin sa science and technology. Nabanggit nyo kanina, yung budget basically translates to less than 1%, about 0.5% lang of the national budget. Para lang po may context tayo, pwede nyo po bang ihambing yan? Ano po bang binabudget na mga ibang bansa? Let's say dito na lang sa ASEAN pagdating sa science and technology or for that matter sa research and development ng mga bansa nila?
Well, actually, ang UNESCO, ang sinusukat nila yung government expenditures for research and development. Hindi naman nila sinusukat yung percentage na napupunta sa kanilang Ministry of Science against the total budget. So pagka kinumpute mo yung government expenditures for R&D, hindi lang naman DOST yun kasi ang DA meron ding budget for research, ang DANR may budget din for research, ang DOH may budget din for research, ang CHIED may budget din for research, pero yung lahat na yan ay sumusunod sa National Harmonized R&D Agenda na inaaprubahan ng NEDA sa pagsisimula ng 6 na taon ng isang term. So pare-pareho naman kami ng sinusunod. Ngayon, ang ating percentage, nabanggit ko kanina yung percentage ng budget ng DOST against the total budget na one half percent ano. Pero kung iko-compare mo naman yung government expenditures against the gross domestic product ng buong bansa, yun usually yung tinatawag na GERD, yung average sa buong mundo ay 1%. Yung sa atin ay
Mm.
0.15%.
0.15. Okay.
Yung mga yung research nyo on mga herbal medicine, kasi well, herbal treatment kapareho ng virgin coconut oil, yung mga lagundi, yung tawa-tawa, maapektuhan ba yun? How's it going? Yung mga testing nyo nun?
Yun ongoing na, may budget na yon yung mga sinasagawa naming clinical trials diyan sa Lagundi, Tawa-Tawa, BCO, melatonin, yan meron ng budget na nakaset aside. Pero yung kung magkakaroon kami ng mga bago, siyempre pwede pa rin kukunin doon sa bago naming budget. Maapektuhan din mga bagong proyekto doon sa aming Tuklas Lunas kasi hindi natin marami tayong sakit na ina-address at ang ating biodiversity ay napakayaman na pwedeng pagkunan ng gamot. Mahigit 500 na yung pinaghati-hati namin na dati kasi ang UP College of Medicine lang ang kasama namin sa research sa herbal medicine since 1980. Kaya nga na-discover yung Lagundi noong 1980. Pero sa dami ng pwedeng aralin, hindi naman pwedeng UP lang ang gumawa. Kaya ngayon halos mga 15 universidad na ang may capacity to undertake drug development research sa pamamagitan din ng capacity building na ginawa ng DOST. At sa ngayon, meron kaming 28 produkto na naghihintay na either ituloy siya hanggang sa mga clinical trial o kaya naman ay maghintay na lang kami ng private sector na gustong gumawa ng clinical trials, maaapektuhan yon. Meron din kami mga active ingredients na tinatawag out of the 28 na yon na actually pwede nang gawing mag-umpisa ng gumawa ng gamot yung mga pharmaceutical companies. Hindi naman kailangan DOST lahat ang magtuloy-tuloy ng pagtatapos para sa gamot kasi kung meron namang interesadong pharmaceutical companies, magbayad na lang sila ng royalties sa gobyerno at ituloy nila yung research nila. Pero napakalaki ng potential. Kahapon lang nag-report yung aming mga researchers sa University of San Agustin sa Iloilo. Kasi ngayon nga ay hindi lang limited dito. Iba't ibang rehiyon ay meron ng mga gumagawa ng research sa aming Tuklas Lunas program. Yung sa Iloilo, University of San Agustin, na pinalad sila, meron silang 2 alumni na nasa abroad na sumubok munang magbalik scientist dito for a while, nakailang balik, ngayon ay nagsettle na sa University of San Agustin. Sila ay regular faculty and researchers na doon. At ang kanilang concentratean hindi yung halaman, kung hindi yung mga lupa sa ilalim ng dagat. Ang dami palang microorganism sa marine sediments. Noon, una akong pumunta, sabi nila meron na silang collection ng mga 300 of these microorganisms na nakukuha doon sa ilalim ng dagat. Kagahapon, inireport nila, nasa 3,000 na raw ang collection nila. At yan ay may mga potential na maging antibiotics. Ayaw na kasi nilang mangyari ang nangyari noong 1952, I think, nung na-discover yung antibiotic na ginawang idozone. Yung idozone ay antibiotic kasi yun, ang research ay ginawa sa Iloilo, ang nag-research ay Pilipino, pero yun ay research activity ng Eli Lilly. Kaya nung ma-discover yun at maging gamot, ang Eli Lilly ang nagkaroon ng ownership ng intellectual property at kahit isang kusing ay walang napunta sa Pilipinas. Kaya iniiwasan na natin yon dahil marami tayong pwedeng ma-develop dito. Yun ang sinasabi kong mga potential natin na hindi natin na ma-maximize.
Secretary, may program din ba tayo? Kasi nabanggit namin kanina yung robo-nurse ng Taguig. Local robotics team nung syudad yung gumawa nun eh. Meron din bang DOST na ganong program? Robotics?
Usually kami nagko-co-sponsor ng competition, pero yung pagbili ng mga robotics gadgets na yan ay usually ang local government ang bumibili para sa kanilang mga eskwelahan. Kaya ang mga nangunguna diyan ay ang mga syudad na mayayaman ng local government. So halos karamihan ay dito sa Metro Manila. So ang Makati, ang Taguig, ang Parañaque, ang Valenzuela, yan ang may mga Pasay ay may mga malalakas silang team sa robotics. Yung iba ay mga private schools din na nakikipag-compete. So ang amin diyan actually kami ano lang na mag-sponsor ng mga competition, pero actually ay sila naman ang bumibili ng kanilang mga gamit sa robotics at magagaling sila at nananalo sila sa ibang bansa.
Okay, Secretary, marami pa kaming tanong, kaya lang unfortunately we've run out of time. Good luck po sa budget ninyo. Thank you.
Oo. Anyway, siguro as a last point lang, ang ating magandang news ay although wala pang official announcement, pero nandun daw sa timeline ng WHO na within October ay magsisimula na ang clinical trials. Ano? So inaabangan na natin yan at naghahanda na tayo. Kasi kung yan ay
Ano
magsimula
exactly
na,
yung drug na yun, Secretary?
Ha?
Which drug, which vaccine yun?
hindi pa nila ina-announce. Hindi pa nila ina-announce. Pero yung ating vaccine expert panel, alam nila kung ano yung nangunguna. Yaan, actually, bukod naman dun sa WHO, ay meron na ring mga nakipag-arrange sa atin na mag-conduct ng independent trials kung hindi man sila makakasama sa WHO. So meron na kaming 5 pinirmahang confidentiality data agreement. Ibig sabihin ay willing na ibigay ng mga kumpanya na yon ang datos nila sa kanilang mga clinical trials. So it means that interesado na sila na mag-clinical trials dito. Pero may suspecha ako ng karamihan doon naman ay makakasama din sa WHO Solidarity Trials. Maliban na lang doon sa iba na talagang ayaw sumali sa WHO Solidarity Trials. So, ang estimate naman namin, depende rin kasi sa pagkuha ng volunteers, ang actual clinical trials, kung meron ka ng mga volunteers na kinuha, ay usually maglalast between 3 to 6 months. So, kahit mag-umpisa tayo ng October or November, makukwenta nyo na nandun pa rin tayo sa second quarter of 2021, magkakaroon ng mga natapos na clinical trials at doon pa lang simulang suriin ng FDA kung pwedeng bigyan ng approval.
Medyo matagal-tagal pala yung timetable.
Maaga pa yun, no? Early yan.
Oo nga.
Kaya ako yung nagsimula na rin uminom ng BCO.
So hindi pwede yung vaccine by November.
Ay nako, malab. Ewan ko lang kung merong private company na mabilis at hindi na magdadaan sa clinical trial dito. Pero kung ako tatanungin, mas mahalaga, mas mabuting magdaan sa clinical trial sa Pilipinas para alam natin kung ano epekto sa Pilipino. Kasi ang bakuna pwede rin magkakaibang epekto sa iba't ibang ethnic groups.
Okay. Okay. Secretary Fortunato de la Peña of the DOST, maraming salamat po for joining the Chiefs. Thank you.
Sige. Anyway, kami
Yes.
naman sa budget, kung ano ang dumating, sige. Pero natutuwa kami kasi kanina 3 oras kami sa hearing sa House of Representatives, kahit isa ay walang naminta sa amin at lahat ay nagsabing gusto namin kayong suportahang magkaroon ng higher budget. Kaya kahit gano'n katagal ang tanong nila, masaya kaming umuwi.
Sana
wala po nagsabing panay research kayo para sa bayang research eh. Walang ganun.
Balita nga baka nga daw madagdagan pa.
ang kanilang paghahanda at ang kanilang pag-support.
Baka nga daw madagdagan pa. Good luck po sa budget. Thank you,
Salamat. Salamat sa inyong sa amin, pag-monitor sa amin at kami natutuwa. Thank you very much.
Thanks
Mabuhay po kayo.
Okay. We'll just pause for a break. Don't go away. The Chiefs will be back.
Yung intro first. Okay, well, Welcome back, the Chiefs. We are now in the final stage of our conversation, and joining us is Dr. Jaime Montoya, Executive Director of the Philippine Council for Health Research and Development. Good evening, Doctor.
Good evening, Doc.
Good evening,
Good
Doctor.
evening.
Doc, I don't know if you were listening in, pero kasama lang namin kanina si Secretary De La Peña ng DOST. He was saying, look, kung ano mang budget, pagkakasahin natin yan, we will do the best with our budget. But of course, we also ended up talking about the clinical trials in the Philippines, where we are at this point. Maybe you could give us an update on that front, sir. Yung mga clinical trials, participation natin sa mga testing, where are we on that front?
Well, first of all, clinical trials is a broad area. Hindi ko alam kung ano ang gusto nyong malaman sa clinical trials, pero for example, sa kasalukuyan, we are still continuing the solidarity trials for drugs. So mga repurposed drugs ito that are being used for COVID-19 or being tested to be used for COVID-19. We have close to 1,000 patients enrolled in more than 23 hospitals in the Philippines. And 2 drugs have now remained still being tested. That's remdesivir and interferon. Yung dalawang nauna, yung hydroxychloroquine at yung lopinavir ritonavir, which is an HIV drug, have already been discontinued because they've been proven not to be beneficial.
Oh.
So that's the way it works.
Ano difference
WHO
ng
doesn't work.
remdesivir? Yeah. Ano pong difference itong remdesivir, halimbawa, and the ano yun?
Hydroxychloroquine is an old drug that's being used for malaria,
Okay.
and it's being tested for possibly for COVID-19. And then
Okay.
yung lopinavir ritonavir is an anti-HIV drug that's
Ah,
also being tested for activity against COVID-19 virus. So those 2 drugs have been discontinued already because the data that have been collected so far, because alam mo itong mga solidarity trial, as the word implies, solidarity, it involves multiple sites across the globe. So once they see that the results are not promising, they stop the trial and move to another one. So
okay.
itong solidarity trial ngayon ng WHO, may dalawa pa na tinutuloy. Seems to be promising. I cannot commit, but seems to be promising. But they're also looking at another 2 drugs to be included in the list. That will be put in when these 2 drug trials are finished. So they come in succession. Now yung vaccine solidarity trial is the same. It will be in batches and it will be done in succession. So,
Ay, Doctor, gaya nga po ng sabi nyo, no promises to, you cannot commit. But can you share some of the positive and encouraging insights that you've been finding on these continuing trials?
well, sa vaccine, I'm sure the Secretary mentioned it already. Sinabi na niya kanina na we have what we call sa vaccines, we have the solidarity trial to which we are committed. It's organized with the WHO. We're not sure how many vaccines will be included there, but I would imagine it is at least 6 vaccines that will be actually tested in succession, maybe in groups of 3. So once they see it's not working, they stop it and they go to another vaccine. And that will be done in 200 sites in more than 100 countries worldwide. And we are actually one of those countries. And I think the Secretary also mentioned that for the solidarity trial, the results will be fast. It will be, some will be finished in a matter of 2 months or 3 months. Because as you probably would imagine, simultaneous sites are going on across the globe and the recruitment of volunteers will be fast. Hindi lang sa Philippines ginagawa, so worldwide.
Pero yung,
And that will also give us
pero yung
local
timetable po,
experience.
the timetable that Secretary De La Peña described earlier to us was something like even 6 months, no, from start. So he was seeing a second quarter result at the earliest pa. So that's a far cry from your 2 months. Are we talking about the same vaccines and the same
No.
solidarity trials?
Okay, let me clarify.
Oh,
The vaccine solidarity trial, as I said, will actually involve, I think, at least 5 or 6 vaccines. The design of the trial is that they're not given at the same time, meaning lahat ng 6 o 5 ay magsisimula ka agad. No, they first try or start with 3, for example, and then those 3, kung as early as the 2nd or the 3rd month ay mukhang has no benefit, they stop it and they move to another 3. No,
okay.
so that's why I was saying na maybe in 2 or 3 months. However, if the vaccines are behaving well, performing well, it may
Yes.
even be longer because then they have to confirm whether it is actually doing some benefit. Kasi alam mo, sometimes doing nothing is better than doing harm. Meaning,
Yes.
the drug may not be causing any harm, but is it actually doing anything different or any added benefit? So you have to
Oo.
extend it further and see whether there is an actual benefit. Then it will require a longer time. That is why I was saying for the good drugs, for the successful drugs, our estimate will still be, it will be available sometime in the second quarter of next year. We also have to consider the registration process. Kasi pag natapos ang phase 3 clinical trial, the developer has to analyze the data, put them all together, which will be coming from different sites. That will also take time before they actually consolidate it and submit it first to their home FDA. For example, if it's a US company, then they submit it to FDA. If it gets approved, then they submit it to the other countries because rarely will it be na nauuna yung FDA ng ibang bansa compared sa FDA nila.
Yes.
Usually, it follows, but not before. No?
Mm.
So,
Doctor,
that will take,
Doc,
so
linawin ko lang
consider
po.
that.
Doctor,
Doc, linawin ko lang po because sabi nyo, sorry, I mean, linawin ko lang to before, because you said rarely. We can understand if that's the rule, no? Na hindi pwede mangyari. But you said rarely. Have there been special times or extraordinary occasions when hindi ganun ang nangyari, na nauna nga yung...
Yes,
yung,
I mentioned that because historically, there are certain drugs that were approved, in fact, in the Philippines earlier than the approval done in their home country. A perfect example is lamivudine. It's an HIV drug. I think it was introduced in the early 90s. And the Philippines, in fact, was the first country to, approve the use of lamivudine. So it really depends. Maybe the evidence that points to its usefulness is very strong and convincing. That's why you don't need to depend on the FDA. But there's such a thing as emergency use, application (EUA). The EUA does not require that it be approved in the initial or the host country. Pwede kasing yung EUA is you just show a certification, call it an EC, that certifies that the company attests to the safety and quality of the medicine,
Mm,
and that gets a provisional emergency.
okay. I-freeze na naman.
nag-face yata.
Okay. Right.
Naputol.
Interesting. Kaya lang, hindi ko lang maintindihan if he's referring to the vaccine or he's referring to the drug, no? Kasi he's using the terms interchangeably. So, simultaneous siguro yun, no? Sir, na-freeze po kayo. You're beginning to talk about the EC, yung emergency use. And that sometimes meron nung emergency certification, kanyo.
Yeah.
Yeah, please go on with that.
The EC is, we call that's a document that the company or developer issues or shows to the FDA that short of its formal registration in their home country, attests to the parang parang ano ang kumpanya ang nagsasalita, nagva-vouch or nagga-guarantee that
Nasa
this is of
employee.
good quality
Yeah.
because it carries a liability that if it's not true, then that company is liable.
Okay. Okay.
And
Doctor,
then they submit that for emergency use.
I see.
Doctor, we're talking about an emergency. Medyo malayo-layo pa yung sinasabi niyong second semester of next year. Kung hindi kasama dun sa clinical trials, halimbawa sinasabi ng China and Russia, they're prepared na to come out with a vaccine eh. Kahit ang
Well,
US, sabi nila by November.
Well, alam mo kasi ang systems vary from country to
Yan na
country.
nga. Kung hindi
And
tayo,
I could
participate.
be very sure that whereas we would like to have the vaccines approved at the shortest time possible, in the Philippine setting, we cannot do that considering our past experiences with vaccines. We have to be very careful and we have to also weigh the benefits versus the risk. You know, benefit is of course protecting the population, but what is the risk? The risk there is that you can do more harm unless you practice due diligence.
Kung i-present nila sa atin yung kanilang yung kanilang studies, detailed studies na results, at sasabihin nila, oh, nothing to fear, na kami, third phase trial, widespread, dami, thousands and thousands. You have more than 1 billion Chinese. Gaano karaming kaya nilang testingin doon? Kung gano'n i-presenta nila sa atin, kaya bang bigyan ng FDA natin yung
well,
approval?
I should say that this is just my opinion. I am not a regulator. I am not part of the FDA.
Yes.
It's discretionary on FDA to determine that. And I'm sure they will be in the best position to weigh the risk and the benefit.
Doc, linawin ko lang po yan. When you say it's discretionary on the side of the FDA, for that matter, on the side of government, ibig sabihin niyo po, I mean, notwithstanding protocols and rules, at the end of the day, this can be a decision made by the executive of government. Hindi kailangan ng batas. How do we get around standard protocols if that is the wish, if that is the need? Kailangan po ba ng batas or pwedeng executive decision lang yan?
No, that is already existing. The FDA has the final say on which products will be approved in a short time or in the usual time. As I was informed, when it comes to COVID-19 vaccines, they have committed to a shorter time of review. But it doesn't mean that a shorter time of review means that you actually miss out on the details. They just are going to work on it faster, but the scientific detail and the robustness of review will still remain.
Doc, what does it take for anybody to join a clinical trial? Yan ba fini-filter niyo pa ba yan? How do you select the participants for a clinical trial for a vaccine?
I can talk only of general procedures because vaccines vary depending on the type, depending on how they're going to be administered, depending on how it was developed by the vaccine developer. The protocols are designed based on these specifications. But generally speaking, when you talk of vaccines, you have to test it in communities where transmission is going on. In other words, where there are many cases. In this case, many COVID-19 cases. Why? Because ang gusto mo nga makita ay kung itong mga bakunang ito ay nagbibigay ng proteksyon. So you have to use the normal exposure, meaning you are in a place where there are many cases, so most likely the virus circulating there. So if you don't get the infection compared to another person who was not given the vaccine, maybe it is working.
Yes.
See?
Yes.
So that's the most important.
Okay.
And the second one is usually you have to be evaluated first that you do not have the disease yet.
Yes.
Because if you already have the disease at the time of administration, so what's the use?
Yes, right.
And secondly, it will complicate the picture because you might say the vaccine is not working when in fact it's not working because you already have the disease
Right.
before it was actually given.
May
So
antibody.
that's the other one.
Yes.
So there has to be baseline studies done also.
But you have to be healthy. Do you have to not be immunocompromised in any way? I mean, may mga-
Generally speaking, yes. We have to first test whether they will work in the general population. Meaning ito yung mga ordinaryong tao na walang kakaibang sakit o walang mga pwedeng mag-cause ng kabawasan ng kanyang immune response. Bago, kung yun ay proven effective, then they will go to those special groups to see whether it will also work in those groups. Ganon usually ang proseso.
May age requirement ba? May age requirement? For testing, age requirement.
Yes, of course. Definitely because that will depend on anong plano nila. Saan ba nila talaga ito unang gagamitin o gagamitin. Again, generally speaking, we start with adults. So
Okay.
usually, itong sa COVID-19 it will be ages 18 to about 55. Why? Kasi if you go with the extremes of ages, either pinakabata o yung mga matanda, you're going to another group na, which is not necessarily the general population. You want to see first whether it works in the general population before you move to the special groups. Pero merong mga bakuna na yung kaagad ng kanilang gusto, isinasama na nila kaagad. So it really depends on what they plan to do. I'm just talking of the general, the usual procedure.
And how do you know when to stop administering the, how do you know, what do you monitor exactly? I think that's the point, no? Kunyari ako, binakunahan ngayon. Are you going to be monitoring me on a daily basis? And what are you gonna watch out for in terms of the side effects?
Well, una-una, because phase 3 trials, usually you deal with thousands of patients.
Yes.
The side effects that you will be seeing here may not have been seen during the phase 1 and phase 2 because the population sizes were smaller. So you increase the population, the likelihood of picking a 1 or 2 cases that will present with some reaction will actually be higher. So by experience, again, generally speaking, they usually terminate the study when there is something untoward that happened. It's a major event. Somebody dies, maybe. I'm not sure. So, you have to stop and find out whether the vaccine has anything to do with the death. Then, if it has nothing to do with the death, then they resume the trial. No? So that will be one possibility. The other one is no one is dying. It's safe. No, nothing is happening. But you notice that parang maraming nagkaka-COVID doon sa mga binigyan. So that means it's not probably not working.
Yes,
So it's
yes.
not worth the waiting.
But how do
Okay.
you
Curious lang ako kasi.
I mean, kunyari lang, sandali, Rob, paano kung kunyari nagkaroon ako ng side effect na malala? Does it come to a point where it's, I'm beyond cure? Paano yun?
No. Well, alam nyo naman kasi, kaya nga we're doing a clinical trial is because we are not sure what the side effects will be, at least the major ones. What we are sure of is there will be no major ones. Now, let me clarify. Usually, when they reach phase 3, we're almost sure that no one will die. No one will have a major side effect. No, I should clarify that.
Okay, ganito na lang.
Nakarating ka ng phase 3, may namamatay pa. Hindi.
Ganito na lang daw kasi actually related naman doon sa tanong ni Lucy itong tanong ko. It's not really a tanong, it's more of an exercise. Kasi alam natin pagka nag-take part ka dito sa mga trial, meron namang mga briefing, may disclaimer, may orientation, may warning sa'yo. How will the warning go? I mean, let's say kaming tatlo, nakalinya kami para testingin, para i-trial yan. How will a standard warning message or disclaimer message or briefing to us go? What will you warn us for or about?
Whatever drug or whatever vaccine is given, the basic requirement is that it should be voluntary, the participation, and they have to be well informed. Ano ba yung trial? Ano ba itong produkto? Ano yung posibleng epekto niya base doon sa mga nakaraang pag-aaral sa phase 1, phase 2? gaano ba itong ka-safe, no? Bago sila umoo, no? This is what we call free prior informed consent, FPIC, and they have to sign. But that informed consent is on a day-to-day, meaning it doesn't mean that just because you signed it, that you are already bound to abide by it. It can also be that the following day, if you're asked to report, you just decide not to come. That's up to you. You're given a vaccine, you don't want to finish it, it's given 2 times. You don't want to continue it, that's up to you. It will not change the amount of follow-up that you will get. Kasi some people think na kapag ako nag-decide na ayoko na ituloy, pababayaan na ako ng mga researcher. Hindi po totoo yun. In fact, even those who are not able to complete the trial, those who decide to stop midway, they're still followed up. Primarily because whether you continued, you finished, or you stop midway, you are the responsibility of the research and the researcher.
Pero Doc, so volunteer pa rin ako. Linawin ko lang yung yung side effects na banggit niyo. Ano ba? Nasabi niyo na nga na by the time dumating dito sa phase na to, medyo kampante naman tayong hindi ka mamamatay.
Usually mga minor yan.
Ano po yung
Usually sa vaccines, fever will be the most common, and pain in the injection site.
Third phase
And
yun.
unable to move it for 2 or 3 days, something like that. So usually those are the adverse effects, but nothing more major than that. I'm just talking of extremes, but that doesn't usually happen, especially after the phase 1 and phase 2.
So kung tatanungin ka, Doc, ng mga tao, mga Pilipino, is it safe, Doc, na mag-volunteer for the clinical trials? Anong advice nyo?
Well, kung ako tatanungin mo, yes. But what people should understand is that when you participate in a clinical trial, you should not expect, why do I say that? There's such a thing as therapeutic misconception. Sorry, it's a word with you, kasi I'm a person.
Ako napuputol
Oh,
sa
warning pa naman yun.
What
What
do you mean by
Okay. Warning pa naman yun. Well,
ano kayo
unfortunately, anyway, mukhang word of caution yun, ano? Well, anyway, we'd like to pwede ka na rin mag-volunteer, ano? Ayan, uli si Doc.
Mauna ka?
Hindi, si Robbie pinakamalakas sa atin, eh.
Sige. Mauna ka. Mauna ka. Ilalike ko.
Well, anyway, we'd like to thank Dr. Jaime Montoya, Executive Director of the DOST's Philippine Council for Health Research and Development. So, tuloy-tuloy ka ba, Robbie? Susunod kami sa'yo kapag...
Ako hindi ko pwede immunocompromise.
Hindi pwede. Hindi, si Ed na lang paunahin natin. Wala siya dito, eh. Si Ed lang ang volunteer natin. But anyway,
at least may reassurance, di ba? May reassurance. Hindi ka naman mamamatay. Medyo sakit lang. So, pero... Okay.
May I just finish on what I was saying kanina kasi mahirap na nakabitin eh. Oo. Yung therapeutic misconception, what I'm saying is akala ng tao o dapat malaman nila na posibleng walang epekto yung bakuna o walang benepisyo na maibibigay sa kanila. Walang masamang epekto pero walang benepisyo na maibibigay sa kanila. Kasi hindi sila dapat sasali expecting that they will benefit from the vaccine. So yun yung tinatawag kong therapeutic misconception. They think this misconception that it's going to benefit them. We hope it will, but it should not be an expectation.
Okay.
So yun yung sinasabi ko na na kailangan klaro. At isa pa, there is a match control. Meaning there's a placebo. You probably heard of the word placebo.
Yes.
It looks like the active one, but it doesn't contain anything active.
Right.
There's the chance you can belong to that arm.
O, doon na lang ako sa vaccine ko.
Hindi doon sa isa. Ibo-volunteer natin si Ed doon sa isa. But anyway.
pero kaya ako researcher ako, no, naging clinical trialist din ako before. Kaya malaki po ang aming utang na loob sa mga nagsumasali sa clinical trial. We always tell them because what they do is really some form of heroism, because who would be willing to contribute to knowledge to find out whether this works or not?
Right.
See? So that's something that we have to recognize the people who volunteer in clinical trials.
Correct. I agree.
Okay.
Go, Robbie.
Tama po yun. Go, Robbie. We will thank you. Well, anyway,
But of course, if it's beneficial,
Yes.
then maswerte ka. You were
siya
given
ang
already an
unang-unang
advance
yun.
dose.
Oo nga. Okay. We'd like to thank Dr. Jaime Montoya, Executive Director of the DOST's Philippine Council for Health Research and Development. Thank you for joining the Chiefs,
Thank you,
Doctor.
sir.
Thank you po.
Good
Thank you
evening.
very much.
Salamat po. Salamat po.
Okay.
Okay.
And that will be all for this special edition of the Chiefs. We hope what was discussed here will keep the conversation going. I'm Ami Pamintuan of the Philippine Star.
I'm Lucy Cruz Valdez of News 5.
I'm Robbie Alampay, and we are One News.